Multiple sclerosis affects approximately 1.3 million people worldwide and over 120,000 in the UK. 80% of these patients will develop some disability, with 50% of people requiring a walking aid 15 years after the diagnosis. London Bridge Hospital is one of the UK's leading centres for autologous hematopoietic stem cell transplantation and is at the forefront of MS treatment. HSCT is a multi-stage procedure. The first stage is to collect stem cells. We do this by giving a small dose of chemotherapy and then roughly 2 weeks later sending the patients to H.C.A hospital where we can collect their stem cells using a technology called apheresis. The next stage is the inpatient stay. During this phase, you will have a central venous catheter inserted to reinfuse your cells. You will then receive a high dose of chemotherapy and immunotherapy, which is known as a preparative or conditioning regime, and this takes 6 days to complete. Once completed, your stem cells will be thawed and reinfused by our specially trained nurses. The day that you receive your stem cells back is known as day 0. After the stem cells are reinfused, they find their way back to the bone marrow and start to divide. During this time, which is called the aplastic phase, your blood counts are very low and you are placed into isolation as you are most at risk of infection during this period. Most patients will stay in hospital for around 3 weeks from day 0. However, this can vary depending on recovery rates. Once discharged, you will require close monitoring through regular clinical consultations, blood tests and scans. Initially, at least weekly for the first month, then fortnightly for an additional month, then at increasing intervals as dictated by your clinical condition. It is important to remember your recovery will take many weeks. During this time, you will continue to be supported by the team here at London Bridge Hospital. Clinical nurse specialists will remain part of your care throughout the recovery phase. If you'd like to learn more about HSCT for MS, please don't hesitate to get in touch.